grade 9 students. I am Miss Alexander, your social studies teacher. Welcome to lesson 12. Today we will continue from where we left off in our discussion on sexually transmitted diseases, or STDs for short. In the previous lesson, we understood that STDs are sexually transmitted diseases, also known as sexually transmitted infections, or STIs. Now, here are a few questions as we go through the recap. These are fill in the blank questions. So when I say blank or space, you are required to fill them in with the correct word or term. So let's go. Question 1. It is possible for infections to be transmitted both blank and blank. It is possible for infections to be transmitted both blank and blank. In the previous lesson, we did mention that sexually transmitted diseases are transmitted in 2 ways. So think about it. All right. If you said both sexually and non-sexually, you are correct, and good job for paying attention. The second question. 2 organisms that cause sexually transmitted diseases are something and something. 2 organisms that cause sexually transmitted diseases are something and something. All right, if you mentioned 2 of these 3 options, then you are correct. Bacteria, viruses, or parasites. Our third question. 2 ways organisms are passed from one person to another person are blank and blank. 2 ways organisms are passed from one person to the other person are blank and blank. So think about it. We did mention it in our previous lesson. All right, if you mentioned 2 of any of these possible options, you are correct. In blood, semen, or vaginal fluids, or bodily fluids. Let's move on to the other question. This is a true or false question, so respond by either saying that the statement is true or it is false. The first one, HIV is an infection with the human immunodeficiency virus. HIV is an infection with the human immunodeficiency virus. Is that statement true or is it false? All right, the statement is true. The second question. Gonorrhea is not a bacterial infection of the genital tract. Gonorrhea is not a bacterial infection of the genital tract. Is this statement true or is it false? All right, if you said false, you are correct. Let's move on to the other question. Most women have symptoms of gonorrhea and they know exactly what is wrong with them. Most women have symptoms of gonorrhea and they know exactly what is wrong with them. Is that statement true or is the statement False. All right, that statement is false. Good job. I'm very happy that you remembered some of the key takeaways from our previous lesson. Now, let's move into today's lesson. What are the objectives for today? Students should be able to 1. Identify some major STDs, and 2. Explain some of the symptoms associated with the diseases. So let's begin by looking at chlamydia. Chlamydia is a bacterial infection of the genital tract. Chlamydia may be difficult to detect because early stage infections often cause few or no signs and symptoms. When they do occur, however, symptoms usually start 1 to 3 weeks after the individual had been exposed to chlamydia and may be mild and pass quickly. So let us look at the signs and symptoms of chlamydia. Some of the signs and symptoms include painful urination, lower abdominal pain, vaginal discharge in women, discharge from the penis in men, pain during sexual intercourse in women, bleeding between periods in women, and testicular pain in men. So now let's look at another STD, genital herpes. Genital herpes is a highly contagious STI caused by a type of the herpes simplex virus, HSV for short, that enters the body through small breaks in the skin or mucous membranes. Most people with HSV never know they have it because they have no signs or symptoms, or the signs and symptoms are so mild that they go unnoticed. When signs and symptoms are noticeable, the first episode is generally the worst. Some people never have a second episode. Others, however, can have recurrent episodes for decades. When present, genital herpes signs and symptoms may include 1. Small red bumps, blisters, or often sores in the genital or anal areas and areas nearby. 2. Pain or itching around the genital area, buttocks, and the inner thighs. Ulcers can make urination painful. The genital area may be painful and tender until the infection clears. During an initial episode, an individual may have flu-like symptoms and signs. During an initial episode, an individual may have flu-like symptoms and signs, such as headache, muscular aches and fever, as well as swollen lymph nodes in the groin. In some cases, the infection can be active and contagious even when sores are not present. So in today's lesson, we would have looked at chlamydia as well as genital herpes. Now we will look at hepatitis. Hepatitis A, hepatitis B, and hepatitis C are all contagious viral infections that affect the liver. Hepatitis B and C are the most serious of the three, but each can cause the liver to become inflamed. Some people never develop signs or symptoms, but for those who do, signs and symptoms may occur several weeks after exposure, and they may include fatigue, nausea and vomiting, abdominal pain or discomfort, especially in the area of the liver on the right side beneath the lower ribs, loss of appetite, fever, dark urine, muscle or joint pain, itching, yellowing of the skin and the whites of the eye, or jaundice. Now we will move into looking at syphilis. Syphilis is a bacterial infection. The disease affects the genitals, skin, and mucous membranes, but it can also involve many other parts of the body, including the brain and the heart. The signs and symptoms of syphilis may occur in 3 stages: primary, secondary, and tertiary. Some people also experience latent syphilis, in which blood tests are positive for the bacteria, but no symptoms are present. At first, only a small painless sore, known as chancre, may be present at the site of the infection, usually the genitals, rectum, tongue, or lips. As the disease worsens, symptoms may include rash marked by a red or reddish-brown, penny-sized sore over an area of the body, including the palms and soles, fever, enlarged lymph nodes, fatigue, and a vague feeling of discomfort, soreness, and itching. Without treatment, syphilis bacteria may spread, leading to serious internal organ damage and death years after the original infection. Some of the signs and symptoms of late-stage syphilis include lack of coordination, dumbness, paralysis, blindness, and dementia. There's also a condition known as congenital syphilis, which occurs when a pregnant woman with syphilis passes the disease to her unborn infant. Congenital syphilis can be disabling, even life-threatening, so it's important for pregnant women with syphilis to be treated. Now we will move on to looking at the human papillomavirus HPV infection and genital warts. HPV infection is one of the most common types of STIs. Some forms of HPV put women at high risk of cervical cancer. Other forms cause genital warts. HPV usually has no signs or symptoms. The signs and symptoms of genital herpes include 1. Small flesh-colored or gray swelling in the genital area. 2. Several warts close together that take on a cauliflower shape. 3. Itching or discomfort in the genital area. And 4. Bleeding during intercourse. Often, however, genital warts cause no symptoms. Genital warts may be as small as 1 millimeter in diameter or may multiply into large clusters. Warts can also develop in the mouth or throat of a person who has had oral sex with an infected person. Now, let's do a quick recap of some of the key points of today's lesson as we wrap up the session. We understood that 1. Chlamydia and syphilis are caused by bacterial infection. 2. Genital herpes is a highly contagious STI caused by a type of the herpes simplex virus, HSV, that enters the body through small breaks in the skin or mucous membranes. 3. Hepatitis A, hepatitis B, and hepatitis C are all contagious viral infections that affect the liver. 4. Some forms of human papillomavirus, HPV, put women at high risk of cervical cancer. 5. Chlamydia and genital herpes infections may be difficult to detect. Well, students, this has brought us to the end of today's lesson. There is so much more that we can learn about sexually transmitted diseases, and you will see that as we move into the next lesson. I am Miss Alexander, saying bye for now and see you in the next lesson.